Welcome to Case Study Series in Strategy Case Study by Skilled MBA Massachusetts. General Hospital Cancer Center's approach to clinical trial equity highlights the importance of inclusive innovation. By addressing the disconnect between diverse patient populations and homogeneous clinical trial demographics, Massachusetts General Hospital Cancer Center aims to improve treatment outcomes. This strategy involves targeted outreach and community engagement to ensure equitable access and representation in clinical trials. Clinical trials often lack diversity, failing to represent the varied patient populations impacted by diseases. Dr. Beverly Moy, from Massachusetts General Hospital Cancer Center, identified this gap, noting the disparity between the hospital's diverse patients and the uniform demographics in trials, leading to inequitable treatment outcomes. Clinical trial diversity is crucial for medical efficacy, as treatments can vary across genetic backgrounds. Ensuring health equity means providing equal access to advanced treatments, improving patient outcomes through better representation. This approach also builds trust by addressing historical mistrust in marginalized communities, fostering more effective and inclusive medical research. Despite efforts like transportation support and multilingual services, MGHCC's approaches fell short. Geographic barriers persisted, and cultural nuances in communication were overlooked. Community engagement events failed to build lasting trust, and financial assistance didn't address systemic access issues. These shortcomings highlight the need for more comprehensive strategies to ensure diverse participation in clinical trials. Structural barriers like work schedules and childcare needs hinder participation. Cultural disconnects in recruitment and trial design overlook community values. Trust deficits, rooted in historical mistreatment, fuel skepticism among minorities. Systemic issues in trial design and eligibility criteria unintentionally exclude diverse participants, necessitating a reevaluation of current practices. Massachusetts General Hospital Cancer Center's data analysis uncovered stark disparities between hospital population demographics and clinical trial participation rates. This discrepancy underscores the urgent need for targeted interventions to ensure equitable representation in trials, addressing both structural and systemic barriers that hinder diverse participation. Dr. Moy's value. Sensitive design framework integrates stakeholder values into clinical trial protocols. By capturing diverse perspectives early, it ensures trials reflect community priorities. Addressing value conflicts, it creates protocols respecting all perspectives. Community-centered solutions are developed, embedding identified values into technical and procedural aspects of trial design, authentically reflecting community needs. Community co-creation involves engaging diverse community members through focus groups and interviews to identify barriers and priorities. Core values are mapped to address potential conflicts between institutional and community perspectives. Inclusive protocols and materials are developed with community input, and initiatives are launched with continuous feedback loops for iterative improvement. Flexible scheduling offers evening and weekend appointments, accommodating working participants. On-site childcare removes family care barriers by providing free services during appointments. Digital accessibility ensures mobile-first, multi-language platforms for remote consent and monitoring. Community navigators, trained from local communities, guide patients through the clinical trial process, enhancing engagement and understanding. MGHCC's cultural competency training equips research staff to understand the historical context of medical research in marginalized communities, recognize implicit biases, and develop culturally sensitive communication. This mandatory training fosters authentic community relationships, ensuring all staff, from principal investigators to administrative personnel, are prepared to engage effectively in clinical trials. Trust is built through transparency by creating clear, jargon-free materials in multiple languages, with community input. Community advisory boards with diverse representation guide clinical trial design. Transparent sharing of trial results with participants is essential, ensuring communities benefit tangibly from research beyond individual treatment. The impact of inclusive trials is evident, with a 132% increase in diversity, enhancing representation from underrepresented communities. A 78% retention rate highlights participant commitment, while a 94% satisfaction score reflects positive trial experiences. Additionally, 12 new partnerships with community organizations underscore the collaborative efforts of Massachusetts General Hospital Cancer Center in fostering ongoing engagement. Inclusive innovation enhances institutional reputation, improves data quality, and boosts competitiveness for health equity funding. It leads to robust trial designs, improving treatment efficacy across diverse populations. Building community trust expands the patient base, solidifying the institution's position as a leader in equitable research. Healthcare leaders must identify value conflicts, aligning institutional priorities with community needs. Co-create solutions by involving communities as equal partners in initiatives. Adopt a systemic approach to tackle structural barriers, not just individual recruitment. Measure success with metrics that reflect both participation and quality of engagement, ensuring comprehensive impact. Thank you, and designing for equity in healthcare is crucial for impactful outcomes. Integrating value. Sensitive design principles not only advances medical science, but also enhances business value. This approach ensures that clinical research is inclusive, addressing both moral and strategic imperatives, thereby fostering sustainable healthcare institutions.